Our Health Minister, Aaron Motsoaledi, has given a hint on what South Africans can expect once the National Health Insurance becomes operational. Dr. Motsoaledi says the NHI aims to improve the healthcare system and making sure that everyone gets a proper healthcare despite one's background. The South African government has been delving in the idea of NHI for many years now. However, some are against the idea of a universal health coverage. Speaking at the SACP's 5th Special National Congress Conference last week, Motsoaledi says children starting school and pregnant women will benefit first.
Health Minister Aaron Motsoaledi says the national health insurance is important because it will help take the burden off public hospitals. He says it will also see more people covered through affordable health insurance. However, the NHI has been faced with many challenges, which amongst others are fears of corruption in governance, possible additional tax, the ambiguity of the role of medical schemes, and the delivery system, which could lead to a shortage of providers. But Motsoaledi says this is the direction the country should take to offer everyone quality health care.
All other countries are moving to mandatory prepayment. Now NHI is mandatory prepayment. The World Organization called universal health coverage. Not universal health care as people are saying. It's universal health coverage, means everybody must be covered with the money that is available for health.
Motsoaledi also hinted on how NHI will benefit learners starting school through a mandatory eye and ear testing.
We are going to make a rule. Every child, regardless of which home they come from, must have an eye test, hearing, oral hygiene. That is going to be our first. We will cost it and show the nation that our first step of NHI is this, all kids.
He says pregnant women without medical aid will also be able to see specialists during their pregnancy through the NHI.
Our next step, pregnant women. We will draw a program where every woman who's pregnant know their package, that they can go and see a GP 4 times during the pregnancy, and a specialist 2 times, and a CT scan 2 times. That is very much affordable. We can afford it. And I can go on and on and on. Those are the things you'll cost. You can't cost the whole NHI.
Earlier this year, President Cyril Ramaphosa in his weekly letter said that access to quality healthcare should not depend on one's ability to pay, and that through careful planning, monitoring, and the strategic allocation of resources can ensure the achievement of universal health coverage. The National Health Insurance was signed into law in May 2024 in a move to level the playing field in the health system. Nothando Makotulela, SABC News, Johannesburg.